For more than 25 years, a nonprofit based here in Chattanooga and the Tennessee Valley has helped women and families to break the cycle of malnutrition in southern Haiti. Over the years, the work of the Children's Nutrition Program of Haiti has endured crisis after crisis, challenge after challenge, earthquakes, gang violence, severe and chronic political instability. Dr. Anany Prosper is country director of CNP Haiti. Kathryn Bolles is the nonprofit's CEO. Kathryn, Dr. Anany, thanks for joining us.
Thank you for having us.
Thank you for the invitation.
Dr. Anany, let's start with an update on the situation there in Haiti and how CNP is able to operate.
Haiti, it is close to the coast of Florida. We have deep human-to-human relationship, economic relationship with the US and Canada. The political situation in Haiti have been degrading in Port-au-Prince. There is also negative press on what is happening. But what we are trying to share is, besides what is happening in Port-au-Prince, there is a country of 8 million people outside of Port-au-Prince that continue to survive and have faith and part of a community. And CNP is one component of this network outside of Port-au-Prince. In the south of Haiti, there is a place called Léogane, 120,000 inhabitants. We are the trustly partners of the local community by providing women health care, clinical services, and children care with a focus on nutrition. And what does that mean in the life of this community? Example, for 2024, we were able to provide clinical services at any given period of point for more than 30,000 children. The women health and prenatal care, including sexual reproductive health, including prenatal, including like immunization for women and lactating women. We're talking about clearly 20,000 act of services. And for children that we rehabilitated from nutrition, we are more than 1,200 of children for this year. So why there is problem in Haiti, and we acknowledge that, but we have to say that we saw this in the past, and we saw many political transitions. Our key priority is to organize the community, come together, support each other, and continue to provide for the people living in that area.
How is it operating now?
Currently, we have increased our bandwidth by hiring on a temporary basis more than 20 staff. We have to implement new care services for the internally displaced people coming from Port-au-Prince because of the gang violence. We have an influx of people coming, and we have to put an ad hoc project on that. And on this aspect, we provide services in 3 camps for refugee people. It was like more than 10,000 healthcare services. And on those camps, we have more than 15,000 people living in 3 different places. In terms of operations, I would like to acknowledge that it is hard because we have to pay attention to the security of the staff, which is a key priority. And when you are a humanitarian crisis, the logistics are more costly. We used to have medicine, oxygens, lab reagent by the ward. Now we have to pay a boat, and the cost is probably 4 times more. And the time also, it takes more time to have the supply. So the operations are heavy, complicated, but because we have this partnership with the community, they help us to figure out more efficient way to get it. Unfortunately, it is not more cheaper, but we are still continue to keep the operations. The other impact is on the service delivery on time. It is time sensitive. Where we used to take 1 week to have the drug from Port-au-Prince, now we have to come for 3 weeks. There is a negative impact on the life of the population because of that. There's an accumulation of services that need to provide. We cannot do that on timely. And that's why we need support. And hopefully the Haitian leadership will come together to fix the political situations.
Kathryn, tell us more about your background coming on board there at CNP, based here in Chattanooga, and how you have been working with Dr. Anany and those in Haiti.
What's interesting, and I'm grateful to tell this story, is that my background with this organization goes back 27 years, actually. I grew up in Dalton, Georgia, and lived in Chattanooga. And I was doing some work in Haiti, in Léogane, as it happens, when I was around 27 years old, and I'm now 53, so a long time ago. And I met some of the people from Chattanooga who were on a mission trip helping the children and the families in the area. And as I learned more about the organization, learned about some of the community within Chattanooga who really wanted to not only provide immediate service to Haitians, but also recognized that health and nutrition was a challenge, particularly for the children, and wanted to do something sustainable. And so I was part of those early efforts building the program that is now what Dr. Anany is describing. I went on from the Children's Nutrition Program to work at Save the Children. For 20 years, I was the head of health and nutrition for Save the Children, and I've now come back as the CEO of the organization to help Dr. Anany, the team helping in Chattanooga, and the many, many staff who are in Haiti on the ground, not only saving lives, but also, as you were hearing from Dr. Anany, at their own peril sometimes. It is challenging in Haiti right now. We've all read the news stories. We understand how difficult a time it is. It is a crisis. What we don't often see is that those most vulnerable in any crisis are those most impacted, and the children are the most vulnerable. And we see that in the nutrition program. We have more cases of severely malnourished children and mothers, I might add, than we've seen in years over these last few months during this real crisis time. And so we're grateful to be able to ask Chattanooga and others to support us in elevating our efforts.
And that includes what happens Thursday, April 10th. Tell us more about that.
The Children's Nutrition Program is holding a benefit on Thursday, April 10th, in which we will share stories of what we're doing on the ground in Haiti, share the stories of our staff and the children and the families, and raise money and support and awareness for this work. And so the organization is holding this benefit at the Signal, which is just behind the Chattanooga Choo-Choo. If you go to our website, you'll find all the information about it, which is cnphaiti.org for Children's Nutrition Program of Haiti.org, CNP Haiti. And we will have an opportunity to gather in a reception area from 5:30 to 6:30. The event begins at 6:30. There is a dinner. There is a silent auction. There are opportunities to have some live auction and some live donation opportunities, and really to be a community and come out and support Haiti. There are seats available. I really encourage everyone, if you can't attend on April 11th and join us, then go to the website and sign up for our newsletter, call us, chat with us, and we really want to inform and share some of this with Chattanooga and beyond.
And again, the website?
cnphaiti.org.
All right, Kathryn, Dr. Anany, thanks so much.
Thank you for having us.
Thank you.